grateful. Woo! Yes, I have come to say thank you, Lord. Clap those hands together. You know the song already. Come on, come on. Woo! Let me hear you scream, South Africa. Woo! Here we go. Yes, 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 yes. Today, I really want to talk on a very beautiful topic. A very beautiful topic that everyone is going to benefit, but the most people that is going to benefit from this topic is our men. If you're grateful like I'm grateful, wave those hands, say thank you. Yes, yes, yes. All right. All right. Good morning, good afternoon, good evening to you guys. Wherever you're watching this video from, just pick your own greetings. This video is coming all the way from United States of Lagos. All right, before we proceed, let me quickly introduce myself to you. My name is Favor BK. You can call me Nurse Favor BK. You can call me Mrs. Favor BK. You can call me Minister Favor BK. Anyone of the agenda. So that is who I am. So right now, I want to talk on the topic prostate cancer. Prostate cancer is a very beautiful topic, and it's mostly about men. But why I say that everyone is going to benefit from it is because even if you're a woman, you know things about prostate cancer. You can know when someone is at risk of it, and you can know what to do to that person immediately. So let's proceed. What is prostate cancer? This is a kind of cancer. This is a cancerous increase. It's a cancerous increase in size of the prostate gland or testicles, which can also be called prostate enlargement. Why the enlargement has to come in is because it has to do with your testicle. So it enlarges, and once it has enlarged, it's a big thing, a very, very, very big thing. So that is it. And where you find that is in men. Honestly, prostate does not have respect for anyone. It is in all men. You understand me? It's everywhere in men. But the normal status of prostate cancer is 20 milligram. You can see it in a day old, 2 days old, 3 days, 1 month, and thereabout. And it is just 20 milligram. That's the weight. It weighs 20 milligram. But when you consider that prostate cancer is no longer normal, by that time it will become like 200 milligram. That is when you know that you are now at a very high risk, that this one is no longer a normal one, is now abnormal. 200 milligram is no longer normal. And this prostate cancer, it can be found in men and can be seen in the bladder of men. That's where you can see prostate cancer, in the bladder of men, not women, but only men. That is where you can see it in their own bladder. All right, so let's quickly move to symptoms of prostate cancer. Let's quickly move to symptoms of prostate cancer. The number one thing I have here, I'm trying to rush out because I don't have much time. I was giving just 1 hour. So the symptoms of prostate cancer, the number one I have here is a frequent urination. Whenever you notice that you are a man, you are now urinating frequently, often. For 5 minutes you are in the restroom urinating. You are always visiting the restroom for to urinate, you are coming out from the restroom, you want to go back, then you know that is one of the symptoms of prostate cancer. Then number two I have here is trouble starting to urinate. You want to urinate, you know that you want to ease yourself, but you've gotten to where you want to do this stuff, you find out that you are having trouble to urinate. The urine refuses to come out. You will stay there waiting for it to come out. The thing will refuse to come out, and you won't feel comfortable when anytime you notice that kind of a thing. You will never feel comfortable when your urine refuses to come out. It's a very, very bad thing. If you see men who are experiencing that kind of a thing, men, they are always crying. You will see a man crying because of such a thing. The number three I have here is inability to urinate. Is either inability to urinate or loss of loosed bladder. Let me explain it. Some will have inability to urinate at all. Urine won't come. It will just be going down. Now gonna park it up there, and everywhere you'll be feeling pains. While some will have a loosed bladder. What do I mean by loosed bladder? Urine will be just going out anyhow. You want to ease yourself before you can even be able to say, I want to ease myself. The urine will just be flowing on its own. It's a serious problem, and no one deserves to suffer from that kind of a problem. You understand? So that is it. Loose bladder control in some men. So you will never be able to control your bladder anymore. Everything is now loose. Urine is just going out anytime. Anytime you want to ease yourself, everywhere the bladder will be loosed. Urine will be going out at random. The number four I have here is blood in the urine. Blood in the urine. Such people, they usually, whenever they ease themselves, you see blood in their urine. So anytime you're seeing these symptoms, know that you're already having prostate cancer. These are the symptoms of prostate cancer. The number five I have here is pain in the pelvic. Pains in the pelvis and or at the back. You notice that your pelvic area, you'll be having severe pains. You even want to stand up, you are feeling too much pains. So anytime you're seeing all this kind of symptoms, my brother, better rush to the hospital. Any nearest hospital you can find yourself, go and take precautions of whatever that is happening to you. Now, the next thing I want to talk about right now is complications of prostate cancer. Complications of prostate cancer. We don't have too much time, so let me quickly run it over. Complications of prostate cancer. Number one I have here is urinary tract infections, UTI. Once you have already gotten this prostate cancer, if you did not do anything about it, and it takes long for you to to do something medically about it, you will begin to have complications. You begin to have severe complications, and one of the complications I'm talking about is a urinary tract infection, UTI. You now notice that you are constantly having infections, and you won't find it funny. Once this kind of complications begin, you won't find it funny anymore. While some people will tell you that urinary tract infection is the cause, let me tell you how it can become a cause. If you have a urinary tract infection and you refuse to treat it on time, you leave it unknown for a very long time in your body without treatment, that is when it can be able to be one of the causes. But when you don't already have it, it can now become one of the complications. All right. Number two I have here is bladder stones. How did bladder manage to? How did them stones manage to enter into my bladder? That is it. Once there is complications, what do you expect? You are already having complications. So the next thing you are going to expect is complications. All right? So, and you see stones inside your bladder, which which you take doctor to do something, that place has to be opened and washed. The bladder has that area, it has to be opened and washed so that the stones can be able to flush out. If not, it's gonna be another heavy blow on your health. Number one, another one I have here is chronic kidney infection. You know, kidney is one of the vital organs we have in the body, and once you begin to have it, is another bigger one. All right, so chronic kidney infection, you will now notice that you will begin to swell up. Every part of your body will begin to swell up. Your legs, so many parts of your body begin to swell up. That is when you know that you've developed kidney problem, and it is one of the complications. So we really need to take proper care of ourselves. All right, and avoid complications. Avoid complications. How can you avoid these complications? By knowing what to do. Immediately you notice the symptoms, you start doing something so that complications will not meet you up. All right. Okay.